Tammy Benviat was getting ready to leave Hutchinson Regional Medical Center in rural Kansas, where she'd been standing outside peering into her husband Daniel's room, when she thought she saw him wink at her through the window. But Daniel was unconscious, sick with COVID-19, and hooked up to a ventilator.
It was just that one eye that he always winks at me, and I just think, maybe if I give one more seconds, maybe he'll wake up, you know?
After pounding big U.S. cities in the spring, COVID-19 has now engulfed rural and small-town America. Cases and hospitalizations are spiking nationally, but reported case rates in the Midwest are more than double that of any other region in the U.S., according to the COVID Tracking Project, up more than 20 times from mid-June to mid-November. Many Midwestern hospitals severely lack beds, equipment, and clinical staff, according to Reuters interviews with medical care providers and public health officials in the region. Some are repurposing areas to accommodate COVID-19 patients, or cramming multiple patients into a single room, and are asking staffers to work longer hours and more frequent shifts. Hutchinson Regional has 190 beds and only 18 in the intensive care unit. Due to staffing shortages, ICU charge nurse Christy Sork has been working night shifts, which she doesn't normally do.
We are still having to take care of the same sort of patients that they do in a larger facility with less hands on deck at times. So staffing has definitely been a struggle for us at times, with a lot of people working extra hours.
The physical and emotional fatigue is constant, and even harder when the patient is a close friend or colleague, which is common in smaller communities. Kevin Hoover has been a registered nurse at Kearney County Hospital in rural Lake, Kansas for 20 years. He often sees friends, neighbors, and family come through the doors.
There's a gentleman here currently who I have known from from playing golf. He is a golfer that I know, and in talking to him, you can just, sometimes you can sense the fear because of the unknown.
Facilities like Kearney, known as critical access hospitals, weren't made for this. They mainly provide basic or emergency care to residents who live long distances away from bigger medical centers. Still, medical workers told Reuters that denial about the disease or preventative measures is frustratingly common among public officials, community members, and even patients. As nurse Christy Sork puts it,
We're a very divided area here. Even people that are healthcare workers don't always believe in the mask. They may believe in the illness, but they don't believe in the mask to help prevent the spread.
All told, COVID-19 has claimed more than 256,000 lives in the United States.